special This Week in Pharmacy feature, and this is on all of our minds. This isn't just something that I've come up with. Obviously, pharmacists out there throughout the country realize how our world is in a lot of pain right now with some of the global conflicts that have been taking place. I've talked about MedikaLife a lot on the Pharmacy Podcast Network. We are actually a podcast that is featured through MedikaLife. A shout out to Gil Bash for his direction, and a shout out to FINN Partners, who's been a wonderful collaborator with me over the years. A friend of mine who taught me a lot about the details of global conflict. I'm going to be featuring today, but I'm going to put this link in the show notes. The title of this article is "The Hidden Cost of Global Conflict: Why Health Security is the First Casualty." And this goes from a first point of view of the relationships that this author has on an international level. And I want to go through this today. I would like to welcome my friend Aman Gupta to the show. And Ahmad, it's been way too long. We should have done this sooner.
We should have, Todd, but thanks a lot for having me as part of this amazing conversation, and I would sort of say a most relevant conversation in today's time. So I'm really excited to be and thankful to you to sort of have me as part of this conversation.
Yes. There's a funny saying and game that they came up with about 12 years ago called the Kevin Bacon effect. And Kevin Bacon is a well-known actor in Hollywood, and they say that everybody's connected to Kevin Bacon within 5 or 6 points of people. And you and I are closer connected than anything Kevin Bacon could ever do. So maybe we should say it becomes the Aman Gupta effect. But you have connections to the pharmacy industry, not only in the United States, but also in India. And that's very special to me because I want to cultivate listeners and content that really shares with 85,000 listeners that we've developed for 17 years podcasting. So having you talk with our listeners today about the true impact from your perspective in this wonderful article that you was very heartfelt, but also it was jammed with a lot of factual information. Talk to our listeners, tell them about yourself, tell them where you're at and where your main home offices are, and then let's get into this article.
Oh, thank you, Todd. I'll try to make it like really quick. And as I said, I'm based in India, and I started my journey with the pharmaceutical industry, and then pivoted to become a health communicator in year 2000. So this is the 26th year of being a health communicator, and I believe the role which we play is very, very critical. Now, India is sort of seen as the pharmacy of the world. We do supply across more than 150 countries, and the whole idea is that access to the medicine per se should be your first right, because nobody should be living in ill health, or somebody should not be living in where the quality of life is kind of a low. So I think that's kind of a basic premise which exists. And when I was writing this particular article, it took me back to year 2001. That was the first time when I met Professor Jeffrey Sachs. He's one of the global thought leaders from a health economics perspective. And I was managing his trip to India. And one of the things which really stood out for me as a student of, and as kind of a student for life, is that how health and economics are interlinked. So when we sort of talk about anything which impacts health, and in this part, and being in the West Asia conflict currently kind of going through, and we are more closer to that, we don't see the layers beyond what might be getting reported into the media, because that's the immediacy of what's happening. What will follow through over the course of the next months and the years is much more larger, because what is done is that it has pivoted the priorities to something which is more led by defense, is more led by the conflict. And when that's how pivoting happens, it sort of it allows people to sort of say, I'm not going to focus on what is the core, which is the health part of it. And when health is not given its due priorities, it will impact the economics. It will impact the people per se, not just from a physical perspective. It will impact them from the quality of life, therefore the mental well-being part of it, and so many other things. And therefore the overarching perspective of how we as humanity are living on this planet starts to dip down. So the impact is much more bigger. It's not something which you can quantify in a dollar value or in a percentage format. It's much more larger, and that thing will continue to echo post the whole conflict is done. And that I think is a bigger issue, and why one conflict definitely should be avoided wherever it is kind of a possible, but it should not be allowed to impact the health part of it.
That makes a lot of sense. I have a sensitive question from your opinion and understanding. Why are Americans so unattached in many ways from what else is happening in the world and not understanding that the health and the well-being of others is coming full circle, and it is impacting economies, and it is impacting the ability to grow and to cultivate the specialness of one part of our global culture versus another. And I think we miss it because we get too involved in our iPhones and our TikToks, and we centralize, and it's I almost feel like we're a little bit, our culture is a little bit of a selfish nation in some ways, because we don't understand the interconnection. And you've had an opportunity to connect to other parts of the world, bring out the stories through your writings, connect with clients who are very much relying on you to get the communications out about what they're doing to help other people. Talk to us about kind of that dynamic. And is that part of all humans that kind of centralize and we forget about each other? Or do you think, like I actually have a strong opinion. I think the United States tends to be, our culture and our society tends to be a little bit more selfish.
Okay, so I would not try to. I don't think it's a specifically to a geography. So it's not just in what you say happening in America per se, that they are kind of isolated from the rest of the world. It's an aspect, and it was something which I was reading today morning itself. It's an aspect of privilege versus not privileged per se. So let's sort of look at the globe in its totality, right? You have the developed economy, the emerging economies, and as what we call is the least developed, or the LMICs, the low and middle income kind of things, and then of course you can further down. Now, because there is inequality which exists within the way the whole economies are doing, it's the people who reside there. So as I said, it's not just something which you will see within, say, in America. You will see within economies like India, where people who are privileged, which I figured out today morning, the privilege basically means I have a private law. So there's a general law and there's a private law. Privilege comes from the Latin word, which is prive law, which is my own law. And I'm thinking from that particular lens. And it's not something which you would like to put a finger on somebody saying why you're thinking, but that's how you see the world. It's the lens through which you see the world. I think the aspect which is very important is, and I think it's something which individuals and the community needs to think, is that you're not isolated. The main important aspect is that in today's world, you're not an isolated country, you're not an isolated community. Everything is interconnected. And tomorrow, if any of this interconnection breaks down, it will have a direct impact on you. So, just for an example, if we look at it, we know that China is one of the biggest suppliers of almost everything
Hmm.
across the world. And in a COVID and a post-COVID world, geopolitical thing, we do know that if China decides that I would like to isolate myself, it will have an impact on everybody else. So the interconnectivity becomes very essential. And I think it's something which Todd, you and I have discussed in the past that we need to look at world as an interconnected humanity.
Hmm.
How that connection needs to be seen as a positive, as a strength. And if we can do that, we will be in a world where things become so much easier to be exist, where the strength of one becomes the strength of the somebody else. We need to look at a world which is much more positive in its thinking rather than trying to look at the negatives and try to sort of say that there is a certain kind of a supremacy which exists somewhere.
So the global economies, which I'm not sure if my listeners realize this, but India is the sixth largest economy in the entire world. And to make that top 10 is significant in the impact of the health of India's economy has on the ripple effect of the entire world. And I didn't realize that. I was preparing for our notes and some of my questions that I had of you. That's immense. That's $4.15 trillion dollars in domestic product and in the impact. And the third largest global economy is India. When I think of that, I immediately think of the privately owned pharmacists and pharmacies throughout the country. Talk to me about what you've noticed about being a pharmacist or working with pharmacists or people that, because for us in the States, it's the most accessible person of all of the healthcare providers. It's more accessible than the general practitioner physicians. It's more accessible than our nurses, which are so they're the number one trusted. Pharmacists came in second in trust, and then I think of India. So if India is such a huge amount of commerce happening, let's talk about the individual. What kind of relationship and how does India look at their pharmacist in comparison to other healthcare providers for accessibility to the need for healthcare?
I think, Todd, what you just said is kind of a true for India also. It's such a large geographical spread which we have, from north to south to east to west, while having the same time zone, where unlike US where you have multiple time zones. Plus, what we need to understand is that you have a differential socio-economic ecosystem. And for them, the pharmacist is your first point of call. If I'm not feeling well, I will have a pharmacy which is within the 100 to 250 feet in vicinity of where I kind of stay. So that's the kind of the strength of where India is. There is an organization called AIOCD, which is All India Organization of Chemists and Druggists, which is one of the largest pharmacy
Ottawa.
network which we have in India. And in my 54 years of born and brought up and being in this part of the world, it was one of the easiest way for us to go and have a conversation about your sickness, about your illness. And they were the people who are able to really guide you through the whole thing. And the other thing which has really happened, and I'm not sure how much it sort of is happening in the US, we now have layered that with the whole e-commerce in the pharmacy. So you don't need to go to a pharmacist. The pharmacists had tied up, and you have the whole e-commerce like what you have in Amazon. We have a pharmacy Amazons here, where you just need to upload your prescription, and you're able to get the drugs coming to your house in sometimes within the 30 minutes, because that's how the whole network has been has been set up, it also allows you to look at between the costings. Because one of the things is that we are one of the biggest generics market with the right kind of the quality. So I can look at a drug which is off patent to sort of say, can I go for this generic versus this generic? Because there is a cost differential, but coming from a two good quality Indian pharmaceutical manufacturers, and I can save cost. And that's data is available when I'm going on my e-commerce side of it. So, because as I was saying, access to the medicine should be a right, and it should not therefore get dependent on the pricing. Everyone should be able to make it happen. And just to give you an example, a couple of years back, there was a family person who was going kind of a surgery, oncology surgery in the US from India, and we were part of it. And after the surgery was done, they would prescribe some drugs, and we went to the pharmacist in the US, and I think the pharmacist was so helpful to say you can look at one of the possible generics from India, which you can sort of access it here, which was at a much lower cost because it was an off-patent uh, molecule. So for someone who's coming from a different side of the world, who's kind of not part of the payer ecosystem, having a friendly pharmacist to guide you through some of these systems becomes such an important thing. And it sort of really brings up the whole interconnectedness and understanding that the world is different in different parts of the world, and you need to therefore converse, encourage, and guide accordingly.
There's another subject that is a teaching opportunity to learn from each other, and that is medical tourism, where we have where we have providers from the States going places, from India coming to the States and going to Africa and different places where there's needs. Talk to us about your experiences within medical tourism, and also in our show notes, I'll make sure we put a link in for people that are listening if they're interested in connecting with a medical tourism network and group, because there are listeners that we have who are passionate, who would love an opportunity to travel abroad and become a giver of their time and working with people who are in desperate need. So Gada Abukuik, who is from New Jersey, she is a pharmacy owner. She travels the globe and she goes to some very dangerous places. She was in the Gaza Strip a year ago when there was a ton of fighting going on, and she risked her life to deliver medications specifically for children. And I was just blown away. It made me cry just to read some of her her experiences. But talk to me about medical tourism and how important that is.
I think it's kind of an extension of what Todd you was saying, the whole interconnected world. Now, if you have an elective surgery which you would like to undertake, right? Say you want to sort of go for a total knee replacement, hypothetically. Now, that might be something which, if you go to any system, say in NHS or the US, you may be getting something which is 6 months down the line or 9 months down the line. So one issue is the timelines. When are you getting access to a provider to say, I'm going to do this for you 9 months down the line, so or 12 months down the line. So there's a queue in which you are sort of standing to get access. The other thing is the cost of making it happen. And of course, each economy operates differently. So the cost is high and low depending on which economy you are residing. Now, this is where the interconnectedness comes in. You can come into, say, in India, and you can have an access to the one of the most advanced medical healthcare provider who can make this surgery available the next day, or they will build a thing saying you come in and we'll take care of you. The time you land in India, come in, you'll have the best of the doctors, the topmost technologies in alignment with what's available in the US or any of the global markets, and it will be done at 1/5 or 1/6 of the cost which is there within the timelines which you are looking for. So you don't need to wait for a year. Get it done at the 1/5 and 1/6, but also I would sort of say become more culturally sensitive to the world outside of where you are residing. So it has three pluses which is coming to you. It's allowing you to ensure that you get for elective surgery something which you don't need to wait, do it at a cost which is much more lower. Definitely, it may not be paid by your insurance, but insurance as such is a different thing, but it could be done with through your out of pocket. Plus, you get to sort of meet and see the people which are very culturally different, almost on the other side of the world. So you have a huge learning exercise there. So that's one. The second is the other way around. There are issues which you need a specialist with. As I said, was saying in the just now, we had someone who needed an oncology. It was a rare occurrence of cancer. Now that was something which we knew can only happen in US. So you'd have to go down. So it's not a one-way street. It's not that you have to just come in here because the cost is low. You have to also understand where does the expertise lies. So in a certain cases where it's complex cases, if it is something which you need a specialist for, and the technology only exists in some other part of the world, you will have to kind of travel and make it happen. And I think that really, I think, should be the beauty, that the borders should not decide where you go and get access to the things.
There's an attitude of giving to that, and that's giving of their time and their expertise and tying into people that have needs. And we've heard of specialty pharmacy, our specialty side that's mostly cancers, HIV, and the expense. And now we're seeing people go to Canada. Some people are traveling to Mexico, and the cost for the same medication is drastic, and it's percentage, thousands of percentage lower. And the United States is going through a very volatile time in prescription benefit and prescription differentiation from other countries that have proven that, and this is just a matter of education for our listeners, but medications don't have to be the expensive way that they're, delivered here in the States, and just as effective.
With you.
Yes, it's mind blowing, and I think that we're learning more about international connections and curating and the delivery and the ingredients and the development. And so many of our pharmaceutical manufacturers are global anyway. So my question is, how do we come up with pricing and structures that serve India the same way that it would serve the United States, and vice versa, so that our costs don't crush people? That there's people that are in the United States that are deciding, do I need my medication or do you need to buy food? And it's just, that's a horrible situation to be listening to. But what have you noticed in the contrast between the United States costs of healthcare and medications versus other places throughout the world?
So I think, Todd, if you look at the cost, the US cost is definitely high. Like when I say high, it's like really, really high. And that could really deter anyone. While you may have access to the health insurance part of it, while you may have other payer ecosystem, the basic cost is on a higher side. Having said that, we also need to recognize the fact that the US is where the innovation is happening. And there is a kind of a cost. So what we really need is a balancing act where you do need innovation, and we need to find a right financing mechanism so that people can get access to the innovation. But innovation may constitute 5% of the medicines or the medical technologies which you need. The rest of that really can come in from other parts of the world, which can really take the innovation and then bring it to a more affordable level and supply it back. So it's an equation which has to have both the factors. It has to have the innovators, and it has to have the people who can then, once the innovation chapter is over, can really mass produce it and ensure that people continue to have an access to it. So that's really is what we really kind of need in to ensure that we are able to deliver a quality of health and quality of life which every citizen of this world needs.
That's a good way of putting it. I have been so excited to learn from different writers. Many of them have been sourced from MedikaLife, the collection of so many insights, and the connection back to what we do in covering stories that just don't get enough discussion is quite important. And there's an organization that we're both aware of that I'm very proud that they've grown in the United States as strong as they have for representation of their members, but serving their communities throughout the country as well as throughout the world. But I want to give a shout out to the India Pharmaceutical Alliance and their work over the years. They've worked with me and a team of people that I've worked with, which is called TWIRx, which was a pharmacy management system, a software system. And we've seen their events and we've seen what they're doing. But Ahmad, these people that run this organization are so giving of their time. Every time we ask for some direction or we ask them for some insights, giving of their time, giving of their expertise, and blending that with the pharmacy owners in the United States who are Indian, or they want that familiarity. They feel like there's trust, but then once they build that relationship, they pour that out through their whole community. And I think that a patient that is understanding, they don't know what's happening behind the scenes. What they know is the services that they're getting from their pharmacist. But you've worked with other organizations throughout the world, and IPA, you've known of them as well. And I thought that was a special coincidence before we jumped on the call.
And somehow we're supposed to take that logic seriously.
Yeah, so IPA and the leadership is someone who I have known very well, and they really are the ones who are really bringing the Indian farmer to the global stage. They are the ones who really are committed to ensure that the innovation, quality, and access remains kind of three pillars on which they are kind of really working on. And going to the same thing, that as a pharmaceutical industry, the role is to ensure that people get access to the medicine. I remember a couple of years back, they did a campaign which is called Mission Medicine Delivering Life. The whole idea was that how from the basics of manufacturing to the quality checks to supply chain, how medicine reaches every household and every home across the world. And that really brings the smile and the life in the minds of the people. So from what you sort of said, from the giving part, it's not just a business, it's more about being at the core of every individual to say, here we are to help you live the best life which you can lead. And we are here to support you in each and every step.
So what project is on your horizon next, and where are you going? Because you shared before we started recording that you have a trip upcoming.
Yeah, I'm off to Bombay tomorrow morning, and as what you sort of brought up is what's happening. I'm meeting the IPA leadership. I've known them for a long period of time, and I was I'm scheduled to be in Bombay tomorrow, so I took an opportunity to reach out, and I'm looking forward to having some interesting and insightful conversation with the IPA leadership tomorrow.
I'm excited. I'm excited to hear about that. We'll have to have you back, as well as a team member from the Indian Pharmaceutical Alliance. I want to thank you, Ahmad, for being a guest today on This Week in Pharmacy, sharing your insights. And I just want to say your work is noticed on a global scale. So I feel honored to know you and call you my friend, and we're going to have you back on TWIRx very soon.
Thank you, Todd. I appreciate having me here.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Welcome back to This Week in Pharmacy. My friend, fellow Pittsburgher, back on the show, Dr. Chris Antipas. How are you, Chris?
I'm well, my friend. How are you?
Doing good. Recovered from the long weekend. I needed an extra day because I did a lot of chores. Got the flowers up, but southwestern Pennsylvania is a monsoon right now. It's just rainy out there. That's it.
I know, and when it rains here, it just rains and it just doesn't stop raining. So I guess that's the life we live here in southwestern PA. We're insulated from all the really bad stuff, but we also struggle to get the good stuff. So we're always in a state of discontent with the weather.
78 days of sunshine is the average for Western Pennsylvania. That's crazy. I did not know that. That was a stat that one of my Lola, my daughter's friends, brought up, and I'm like, 7. So I checked it. It came out. It was like, yeah, you're right. It's 78, 79 days of sunshine. That's not enough sunshine for me.
So that in these parts, when it is sunny, people try to take advantage of it as much as they can. They're out on their front lawn sunbathing.
That's right.
Wow.
That's right. Getting burnt.
Yeah. Right.
So we just got back from Assembia. What a great gathering. I was just talking to some of my other colleagues that are preparing for other conferences. We're excited about Idea Share and possibly going to ThoughtSpot, going to the RBC through Cardinal Health, obviously this fall, getting ready for NCPA. But there was something special about Assembia. We're not talking about things that we were discussing, say, 5 years ago. It seems when we go to Assembia, people are on the edge. They're always talking about, hey, what's happening next? And Modesto and Paragon 360 had a booth there, very active booth. You cheated by having the hockey game playing in your booth too, which was a draw. I'm gonna have to remember that too, by the way. But talk to us about your experience at Assembia, and then I have some questions about Paragon's next phase.
Yeah, it was great. I mean, Assembia is, as you said, there's always a very clear sense, and it's palpable, the innovation that's happening in the marketplace. I think it's largely driven by the fierce competition. Like specialty pharmacy, basically everybody's your competitor. And so you have to really fight for differentiation. You've got to deliver service, and the competition is so strong, and everybody's got great marketing messages, but ultimately you've got to kind of prove it. And so the companies that are still around that have survived to date, I think they're really pushing the boundaries to deliver an experience or an outcome that differentiates them from the rest of the field. So I do think that the fierce competition is what drives a lot of that at Assembia, and Assembia has found a way to channel that to an experience where all of these competitors can kind of be in the same space. There's obviously more than just pharmacies there. There are industry folks, there's consultants, obviously drug manufacturers and payers. So there's ample opportunities to get in front of prospects and also partners, current partners and clients. But yeah, we walked away from there feeling really great. It was the unveiling of our newest technology that we're leveraging with Modesto. And all the conversations that we had there were very energizing and they were very positive. We had a chance to show off what we're doing, and people really loved it. So we're feeling great coming out of it. We've had several follow-up conversations already. And the more we kind of show people what we can do and let them now start to see it and experience it, the more excited everybody gets, obviously including us. So it was great. We're really pumped about the follow-up here in the weeks following Assembia.
So personalization of that care, and that care starts out with shock. Someone finding out maybe they have a disease that they're going to have to live with for the rest of their life. So you wrap your arms around this patient, and that's how specialty pharmacy is really setting themselves different than other facets of pharmacy and pharmacy care. And it starts with that patient's journey, not just the prescription. It's dialing into how you personalize care. That personal care team, these people get to know not only the patient, but they know their family, they know the dog, they know what's going on in these people's lives. That communication through maybe texting or email or personalization or something, or follow-up. And then the emotional support that is also tied into how it can affect the financial realm of the patient, and then also the follow-up and constant tapping in of how are you feeling, what's going on, how is this medication, if you're titrating to maybe a larger dose, smaller dose, different medication. It's so hands-on. People say that and it's like a buzzword, but boy, do I know this more than ever now, soaking and spending more time with specialty pharmacists. But expand upon that, because Paragon 360 is taking that to the whole next level.
Yeah. I mean, the stakes are just higher with some of these medications. They have more serious risks. They have more complicated dosing considerations, storage requirements, and life is happening at the same time that you're trying to manage your disease, right? So the idea, another buzz term of the social determinants of health, like these are real. The people travel, or they have issues. They may have, financial challenges. They don't have reliable electricity, or they're in an area, maybe they don't have refrigerators. I mean, life is happening. And when you think about your own personal journey, there are things that happen that you're not quite sure like what you should be doing in this situation. And so that's where having your pharmacist be available to you to be able to kind of support your unique journey, and also have your pharmacist anticipate the challenges that you might be facing. So as an example, I mean, one of the therapies we support has a titration schedule. Like you start the dose and then you have to increase the dose over a period of several weeks. And during this titration, you are just very likely to experience some side effects, some unpleasant GI side effects. And we know this is likely to happen. And so if I'm your pharmacist, I can simply put a label on the bottle, send it to you, send you the information, offer to counsel. You're too busy, like you're at the supermarket or you're at your kid's soccer game. You're like, no, I can't talk right now. Sorry, no, I'm good. I'll just read what you send me. I'll read the information. And then you get this information and you're trying to sort through it. Like that could be the experience. You're basically on your own figuring out this medication, but you have the instructions there. And if you're competent enough to read it and you understand it, great. Maybe you have a better shot than most. But in contrast to that, you can have a pharmacist that is proactively communicating to you and giving you not a whole bunch of information at once for you to digest, but giving you the relevant information at the time that you need it. We call this a journey. You're going on a journey. And at the beginning of this journey, you're going to have this complicated dosing thing where you're going to have to take increasing amounts of the medicine over a matter of weeks. And that journey also includes some rocky roads, if you will, in that you're going to not feel great. But we expect you to not feel good for a short period of time. But if we can get you through that difficult time where you don't feel good at all, on the other side of that is the positive outcome that we're fighting for and what you're suffering for, basically. We can proactively communicate at the right time with that patient on their journey. Their journey begins on whatever, Monday the 25th. That's different than the patients we served last week. And so when you start multiplying that by large numbers of patients, it becomes basically impossible to customize this personal journey for a patient where you deliver the information for them in a timely manner. And we were faced with this challenge, like we want to do this stuff, but I can't actually do it. I can't physically do it. It's not possible for me to manually do this process. That's where our technology came in, and that's how the technology was really born. We want to be better. We want to offer this experience that reaches the patient where they are in their personal journey and help in every way possible to make these medications we're dispensing achieve their desired outcome. So customizing the journey, providing education and support, and getting feedback, soliciting feedback. Hey, how are you doing today? Like, I want to know, because if you're not doing well, then maybe there's something I can do to change that. Maybe I can inquire how you're taking your meds, or maybe you're not storing it correctly, or maybe if it's another drug we dispense that's self-administered, maybe you're not injecting it correctly, but I can't determine that unless I get feedback from you. One of the other key components of Modesto is that we also can access medical information and lab values out of the EHR. So we're creating these custom campaigns. We're educating the patients. We're soliciting feedback from them. We're providing the right information at the time that's appropriate in a bite-sized amount that's, digestible. We're balancing that against social determinants that we've evaluated through assessments. Like, we ask patients these questions to see, like, what's going on? Do you have reliable refrigeration, et cetera, et cetera? Transportation. Some of the drugs we dispense are office administered. You can't get your drug if you can't get to the office to get it administered. So evaluating social determinants, sharing information, receiving feedback from the patient, matching that up with some of this medical data, that is what we're trying to accomplish. That's what we've built with the technology that we're delivering as a pharmacy. And it's kind of rooted in this notion of specialty pharmacy is different. It's complicated. It truly is scary for patients. And we have an opportunity to kind of fill the gaps of the healthcare system where it is today, which is, I think many of us would agree that it's not ideal. It's very expensive, and we don't love the outcomes we're getting. And so as an advocate for pharmacists in general, I think we have an opportunity here. We're doubling down on the technology side, but to your point, like, there's a lot going on in specialty and a lot of opportunity.
I want to return to what you say, because this really piques interest, and that is the connection back to the electronic health record, whatever health system that they're plugged into, that primary care physician who is the specialist in oncology or whatever it is. It's two-way. You're extracting, getting some information, you're updating what's happening in real time per se, and then you're feeding that back so that the physician gets an opportunity to read maybe some notes at some point when they have a visit. Now, not only are they visiting, maybe that visit is 30 days later, 60 days later, whatever. Now they read in, and is the system also passing information to the EHR as well?
So our information is, we're accessing the information through the health information exchange, and we're pulling data out. We are also writing back to the health information exchange, and that data may or may not be accessed by the provider, but what we're doing is we are communicating relevant updates back to the provider. So we're sending it directly to them. We can also communicate to the providers into their EHR and send them messages. So when we have relevant updates or relevant information, we're sharing that back with the provider. We're acting somewhat like a triage element, where there are a lot of things we can handle on our own. If it's related to the medication and it's an administration issue or storage or how they're taking or how they're managing side effects, there are a lot of things that are well within the purview of the pharmacist to be able to support and care for the patient directly. But in cases where we identify there's a broader issue or it requires prescriber intervention, like, what, we're having an issue with this therapy, we need to change the dose, or we don't advocate necessarily to just change therapies willy-nilly, but sometimes it's not it's not the appropriate therapy, or maybe there's a drug interaction that we have to address by changing therapies, we obviously are going to get the physician involved. And when we create care plans for our patients, we're also sharing that with the physician. So the whole notion of interoperability and sharing of information, all of that is really critical and important. And we are in any way, in every way possible, making sure that the providers are involved and engaging them to help support the patient in whatever situation they're facing.
Let's talk financial for a second. So what APIs or connections in is a system able to coach, flag, bring up to the patient that, hey, do you ever hear of Accessia Health, or do you ever hear of this program, or do you ever hear? What other ways are we keeping patients adherent based on the financial strain that's created?
Yeah, so we, as a pharmacy, one of our core services we provide to patients is the financial assistance to help bridge them to available programs, whether those be manufacturer programs or other foundation programs that are out there. There are several companies that are that's their focus, is to help provide financial support. But we obviously, we know that our patients, if they can't afford their medicine, then they're definitely not going to get better. And financial barriers have been a long-standing issue, especially in this industry of specialty pharmacy, where you have these really expensive meds. So we're very mindful of that. We also attempt to, oftentimes health plans have resources for their members, and the members just don't know about it. So we also, in our process of evaluating how to help support our patients, just in doing this as a specialty pharmacy, we also make sure that we consider health plan resources that are already available to them. In Pennsylvania, there's the PACE program. You may be familiar with it, Pennsylvania PACE. It's funded by the lottery. And there are a ton of people out there that are eligible for PACE that they don't even know about it. And so over the years that I've been doing this, I mean, there's countless patients that we have helped enroll them in available programs and like PACE. And yeah, it's a big part of what we do, because we recognize it's an important consideration when you're trying to keep somebody on a therapy. If they can't afford it, they're not going to get it. And we also, we kind of provide additional social support for patients, because sometimes they can't afford food. And so we obviously can't solve everybody's problems. We're not a charity, so to speak, but we're mindful of it, and we're trying to bridge patients to resources that are available to them whenever and wherever possible.
So I'm excited about what's coming. Modesto, the infrastructure that Paragon 360 sets upon, it's a system that you've designed as it's moved forward. I remember 5, maybe even been 10 years ago, just hearing about the inception, the devices, the technology. Talk to our listeners, possibly some other pharmacy owners as well as specialty pharmacy operators. What does the future look like, for Modesto as that platform, in order to obviously give Paragon 360 the needed infrastructure, but also giving that power to other specialty pharmacies?
Yeah, we made the decision to explore making Modesto accessible by other stakeholders. Again, our mission is to help patients, right? Everybody you talk to any pharmacist, that's what they wanted to do, is help patients. We focus on helping patients, and ideally, hopefully, and it's a struggle in pharmacy these days, but build a successful business that does that. Not build a successful business first and foremost. Obviously, you need to be successful you have to make money in order to deliver your vision and your dreams and your goals. But we truly are committed to taking care of patients. We think that we can reach more patients if we open the access to this innovative technology that we've built. So that's what we're doing. And we're working with pharmacies today. We're talking to some drug manufacturers, to payers, health plans, various stakeholders that would love to be able to access the technology, leverage the automation that we've built into it, the ability to customize these engagements and the journey having a rich patient user experience on the other end of it, providing the clinical support, the decision support and guidance support to the pharmacist, the clinician. So that's the future. That's what we're working on doing today. We're rolling that out because we think that if we can empower others to provide this level of care to patients, it's going to help massive amounts of patients. We have to prove, obviously, that it can do what we say it can do. But so far, like I mentioned, the excitement around this idea has been significant. Everybody we talk to and show this to say, like, how can I use this? I'd love it. How do I get access to it? And that's prompted us to really say, like, we need to make this accessible to as many as possible. So that's our vision. That's what we're pushing out, and we're super excited to see what the rest of this year and of course what next year brings, because we expect to have tens of thousands, hundreds of thousands of patients supported through this technology, which will let us prove and show the impact that it can actually make.
One of the components of your life is service, and you're doing that through different sectors of pharmacy. We know about Estes in the Great South Hills of the Pittsburgh area, whereas Paragon 360, much more of a national reach of what you're doing. What else are you working on that you're passionate about, Chris, that you can share with our listeners?
Yeah, I mean, I'm working on lots of different things in the technology space, in the pharmacy care, actively involved in CPESN and providing direct pharmacist services and billing, pharmacist billing as a provider services. I'm very active in the self-funded employer, broker, PBM space, trying to generate some new innovation and disrupt in the space of the self-funded plan to open up access for these commercially insured lives, these commercial self-funded members, if you will, to pharmacy services, because they're kind of stuck in this legacy model of the old way of doing pharmacy. And so I'm very active in some of the work that I do in the consulting space with employers to open up some access there. Right now, what I would say is that I don't think there's ever been a time before in healthcare where it has been more ripe for disruption. Nobody's really satisfied with how things are going, except for the companies that are these Fortune 10, Fortune 50 companies that are making billions of dollars in the system today. They're good with how it's working because they're making money, but basically everybody else, providers especially, patients and plan sponsors, and even drug manufacturers to a large extent, they're not satisfied. And so there's so much room for innovation and, creativity. I'm leaning heavily into that right now. So everything I touch, I'm trying to push the boundaries of how we do things today, the way we think about it, and how we could imagine doing it differently. And so whether that's on drug procurement and purchasing, whether that is in clinical care and provider status, in the technology for patient care, pharmacy dispensing, consulting, etc., I'm trying to put that same energy in all of those aspects that I touch.
I wanted to thank you for spending time with us on This Week in Pharmacy today. Love what you're doing. Always love reading about the different journeys that you're on and the boards of directors that you serve. And I'm like, oh my goodness, where is Chris Antipas now? It's almost like finding Waldo throughout our industry. So
appreciate you, buddy.
Appreciate you as well. Thank you. I hope you have a great weekend.
Thanks so much. Talk to you soon.
Hey, we'll be right back.
Feeling lost with the complexities of pharmacy accounting?
In pharmacy today, there's so many different, variables and issues that impact the pharmacy books, records, accounting, the profitability of the store, so forth. There's different components of pharmacy that have its own nuances from an accounting standpoint. And so it's tricky. There's no doubt about it.
Ready to take your pharmacy to the next level but don't know where to start? Sykes & Company is here to help. Introducing the RX Assessment. With the RX Assessment, the pharmacy CPAs and advisors at Sykes will do a deep dive into your accounting and tax situation and give you the action steps you need to take your pharmacy to the next level.
If you're interested in, working with a team who understands the industry and how the accounting and tax should really be in a pharmacy, this is your chance to get a under the hood check of what's going on and getting the feedback of any issues or concerns or, again, things we think you're doing really well with.
Get the financial checkup your pharmacy needs and head over to sykes-cpa.com or call 252-482-7644.
Hey, welcome back to This Week in Pharmacy. We have a special returning guest. Before I introduce them again, coming back to TWIRx, it's allergy season. I was at a farmer's market recently, very near my home, literally 2 miles away. I picked up some of their honey. I looked at the honey where it was cultivated. It was a local beehive and cultivator, probably within 20, 30 miles of my physical address. And there's like that wives' tale out there that like, hey, if you eat local honey, then it'll help with your local allergies. And made me think of the subject that we're going to be talking about today, which is, information and good information and good resources, the best over-the-counter medicine and health products from U.S. News and World Report. Excited to welcome back Shanley Chen. She's senior editor for U.S. News and Health, U.S. News and World Report. I want to welcome you back, Shanley, to This Week in Pharmacy.
Hi, Todd. Thanks for having me back again. Happy Friday.
Happy Friday. It was a 4-day week, and it was nice that we had Memorial Day, but sometimes when you get an extra day, it actually makes you feel more tired because you're just like in that spirit of relaxing, and then it's just like, no, you got to go to work. So I'm really looking forward to a recovery weekend from last weekend.
I hear ya. I mean, it just throws off your entire routine, your entire schedule, right?
It does. It really does. So wives' tale, eat local honey and it'll help you with your allergies. Have you ever heard of that one?
Oh yeah, all the time. I think I even hear it from my mom. So definitely, definitely holds true in that regard. But I can't necessarily speak to the validity of it. I'm pretty sure that is definitely an old wives' tale. From what I understand, the allergists that I've interviewed, it's not quite this right pollen that you need in order to build that immunity. But yeah, I mean, it tastes good. So what's not to love?
I have to keep telling myself that it's good for me too. So it's like, or
It's
at least
good for you,
in moderation.
and it tastes good.
Exactly. Put it in your, whatever, your tea or your peanut butter and jelly sandwiches.
That's right.
All right. So let's share with the pharmacists and healthcare professionals, our technicians that are out there. They get a lot of questions about over-the-counter medicines and health products. I know from just listening to people in my own circles, people that I've worked with, people that are my family, friends, that over-the-counter products are perceived to be not, hey, this isn't harmful because it's over the counter and blah, blah, blah. So every time this report comes out, I'm always sharing it with my personal network because I want them to realize
Thank you.
Medication is medication, and we have to break this down. So share with us and share with our listeners about the latest report.
Yeah, absolutely. So this is our 4th year doing our best OTC medicine and health products rankings, and we rank nearly 900 brands across 128 categories, including allergy medicine. So if you need an allergy medicine, whether it's, allergy eye drops, nasal sprays, or oral decongestants, we've got you covered there. Even vitamins, sunscreens, wrinkle creams, this ranking really runs the gamut of the different categories that you would encounter when you're going into your local pharmacy, when you're going into your local drugstore, and just walking through those seemingly endless aisles of different brands and products. And so to accomplish this, it's 128 categories. That is a lot of categories of different products. And so, but I'm not the expert here. We relied on the experts, the pharmacists, the dermatologists, to evaluate these brands based on their performance, their safety, and their efficacy. And we rallied 500 of these across the country to really dig into our extensive list and the different products that are available. And we wanted to make sure that, this is a multi-billion-dollar industry. People are spending a lot of money on, their different supplements like, multivitamins for their kids or multivitamins for themselves or their loved ones. Or even things like allergy medicines, and even hearing aids. There are a lot of over-the-counter products that are available to consumers. It is so easy to be inundated by all the different choices. And of course, because supplements are not FDA regulated, or rather they're not regulated by the FDA the same way that it regulates over-the-counter drugs, there's a lot of there's a huge need to rely on our experts for guidance, and this is what we did.
I love it. And I also like how you break it down for the consumers to really understand from an educational perspective the importance of asking your physician and your pharmacist about different things when you select an OTC medicine. And something that the World Report puts out there is reading the label closely, checking the active ingredients, and not exceeding recommended dose allowances. There have been a lot of pharmacists who are getting very big and very influential. We've covered several of them over the years on TikTok, and they're using their pharmacological backgrounds to suggest things. And I really like how you're supportive to both sides of the fence. You're supportive to the providers and you're supportive to the consumer. Talk to me about that balance and how you guys are pushing this information out.
Yeah, absolutely. And to your point, that you brought up earlier, just because it says it's an over-the-counter drug does not make it inherently safe. It goes through a very vigorous FDA approval process to make sure that it is safe and effective, because they are, at the end of the day, still drugs. The allergy medicines, or headache and migraine pain relievers, and even diarrhea medicines. It really runs the gamut here. But all of these are still drugs, and they still do have different drug interactions, side effects, things like that. So we have to really make sure that consumers and our readers know that there are, safety issues with mixing different drugs, and we want to avoid certain drug interactions, whether it's food drug interactions or drug interactions. This is absolutely something that we wanted to unpack, and that's why we relied on our pharmacists and dermatologists to look into what are the different side effects of XYZ drug, of whatever over-the-counter product we're looking at, alongside the benefits. What are the proven health benefits of these products that we're ranking, or these brands that we're ranking? But let's also make sure that people know what the potential side effects are, what potential safety considerations, as well as what are the different drug interactions and side effects these things could carry.
I also like that you're engaging over 500 independent community pharmacists out there and dermatologists out there. And I'm seeing much more collaboration between pharmacists and dermatologists. Talk to us about the selection and some of the organizations and pharmacy owners that you're working with.
Yeah, absolutely. And so we partner with the Harris Poll, who is, renowned for running surveys. And we partnered with them in order to conduct these surveys of our 500 pharmacists and dermatologists. And they're really across the country. And so they're the ones who are seeing the patients who are dealing with these conditions, day in and day out. They're the ones with the expertise. And so we're really relying on them to unpack and explain what the health benefits are, what the side effects are, how to best take a medication, things like that. Or even when it comes to hair care, well, what are the benefits of of hair growth supplements. What are some of the main ingredients and key ingredients that we should be looking for when we're going through all of these things? So again, I think because the health and wellness industry is absolutely just exploding, it's constantly changing and evolving seemingly every year, almost even month to month. That's why we really relied on them, but also why we added 11 new categories to reflect all of those different consumer trends.
We have several podcasts that start to get really into the weeds with a specific issue: pediatrics, sexual health, women's health specifically. There's a women's health products section that breaks into fertility and menopause and prenatal vitamins. This is important for our consumers to understand that quite a difference. And even there's lots of pharmacists now who are getting into contraception, and they're starting to give guidance. And the reason is there have been Planned Parenthood centers that have been shut down throughout the entire country in different reasons for different, funding issues. So I think this women's health section in and of itself is extremely important for our pharmacists to understand. You have accessible information through U.S. News and World Report, and I'm definitely going to put a link into this.
Awesome. Thank you. No, and it's not just accessible information, it's expert-backed information too. And most of, and written by our experts as well. I mean, I'm glad you highlighted women's health because for a very long time it's been overlooked. But now I think with the industry finally recognizing the importance of, marketing to consumers and providing consumers with products that are directed towards women and that address women's health issues, I think is just, something that we absolutely need. But, to your point, we have, fertility supplements. We rank menopause supplements as well as prenatal vitamins. But on the other end, we also ranked testosterone supplements as well for men.
Excellent. Excellent. So give our listeners any additional guidance to the report, anything else that you'd like to mention so that they know that they have information accessible to them, anything you want to share.
Absolutely. I mean, when you go to the website, which I'm sure you will link out to, there again, there are 128 categories there. We cover a wide-ranging a number of different categories, from hair care, allergies, brain health, sleep medications, whether it's over-the-counter sleep drugs or natural sleep aids like melatonin and magnesium, all the way to, diabetic tools. So there are tons of different products to really address whatever needs you're looking for. So aside from just browsing that page, you can just drop in a keyword and it'll pop up exactly right over there. And you'll be able to find whatever product category you're looking for. Again, I mean, I think with the hair care and hair growth industry becoming even more popular, that's something that we expanded on as well. So there are tons of different avenues for you to look at when it comes to your health and wellness goals.
I love it.
I think another thing to add too is, when consumers are navigating this page, or rather navigating this health and wellness industry, our ranking is incredibly robust. Like, we do a lot of work to make sure that our readers and our consumers get the best, highest quality, expert-backed information out there. And that's why we provide all these rankings. Like, we want to be the first step for them when they're shopping online or in stores. But at the end of the day, we want to make sure to also emphasize the point that, these are our experts' recommendations, they're top picks. But if you ever have any questions, please talk to your doctor, talk to your pharmacist.
Heck yeah. I love it. Shanley, this is so good to have you back. You have an open door opportunity to come on TWIRx and share information. We can get some of your pharmacist friends on and we can drill down into some of these subjects. But thanks so much for being on TWIRx again.
Oh, thanks so much for having me. It's been a blast.